You're looking at your semen test report right now in your hand and you're confused and worried. You're thinking 20 plus numbers, arrows, strange terminology, but the only thing on your mind is this normal or not? Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, where we have processed thousands of semen and sperm test reports. And today, I'm going to break down this report for you in very easy ways in just a few simple tips. Most men feel completely overwhelmed looking at their semen test and fertility reports. They fear judgment, inferiority, and also have questions about their own fertility. But the truth is, it's not so complicated. There are actually only 5 parameters that really decide your fertility from this entire report. The 5 and big important parameters are now what I'm going to tell you. The first is the sperm count. What is the total number of sperms in your sample? A cutoff of 39 million is where we stop. Anything less than that and there is a problem. Next comes the progressive motility. Now what does this even mean? You may be knowing that your sperms are actually moving. They move like small little tadpoles in a pond. The ones that move fast are the ones that actually reach the egg and cause the fertility and the pregnancy to take place. If the number of these fast moving sperms is too low, then there is a problem. 32% is considered to be a good value to have. The third is the vitality. What does this mean? Vitality refers to the total number of sperms in your sample which are actually alive. You might be surprised to learn that not all sperms in your ejaculate are even alive. In fact, the WHO says that just 58% of the total sperms need to be alive for you to conceive naturally. The fourth parameter is the fructose. You may not be knowing, but in your semen there is some sugar present which is called fructose, and this sugar or fructose provides the energy to your sperms to be able to swim successfully and move and then meet with the egg and fertilize it. If the fructose is not present in your sample, you are going to have problems with the fertility. And last but not the least is something called morphology. Now this is just a big complicated word for something that actually refers to the shape and the size of your sperms. In the lab, we look at your sperms under the microscope and we can actually see the individual sperm with its shape, size, whether the head is too large, whether the tail is too small, and so on and so forth. We say that only 4% of your sperms, let me say that again because it's such a small number, only 4% of your sperms need to actually be of a normal shape and size for you to conceive properly. So that's it. There are just these 5 parameters that are the first things that you should look at in your report. The sperm count, the sperm motility, the vitality or the number of live sperms, whether the fructose or sugar or the energy supply is present in the semen or not, and last is the morphology or the sperms which are normal in shape and size. But any comprehensive sperm test report is actually going to have a lot more parameters and you might be overwhelmed looking at the whole thing. So I'm going to break down each and every one of these parameters one step at a time, one parameter at a time, in a way that you will completely understand and you will not be feeling afraid of this report. The first parameter that we actually look at, or the first group of parameters, is called the microscopic examination group, as you can see in the image next to me. Microscopic examination is just a long word for basically what it means is we take a drop of your semen and look at it under the microscope, and this gives us a huge amount of information about your semen and its fertility and your health. So the first parameter in that is called the round cells, which is being highlighted next to me. The round cells are basically the things that your body makes to fight against infections. A few round cells in your semen are normal. So if you get a report which says 2 to 3 or 4 to 5, that's totally normal. But if there are a lot of round cells in your semen, then that could indicate that there's some infection going on and your body is trying to fight with that infection, and that is why the round cell numbers have gone up. Now, should you be afraid if this number is very high? No, because most infections can be very effectively treated by antibiotics or antivirals, and so it's not something that you should be worried about. What's important to remember is that if there are more than 1 million of these round cells per microliter, which is a very high number, that's when you really need to start worrying, and whatever it is, your doctor will definitely be able to treat this. The next are the red blood cells. Just like you have blood flowing through your veins, there is some amount of a little bit microscopic amounts of blood are present even in your semen. Just like the round cells, 1 or 2 of these red cells is fine, but if there is a lot of red cells, it could also point at some kind of an infection or swelling in the tract which goes from your testicles right all the way outside to your penis, and so your doctor needs to investigate and see why this is happening. The next are the parasites. Now you might be confused about where a parasite is going to get into your semen from, but yes, it is known to happen. In fact, certain parasites called filaria can get into the testicles, and it can affect your fertility by completely blocking the track from your testicles going all the way out to your penis. Parasites should never be seen in the semen. Even one parasite is abnormal. But the good news is this: it can be completely treated with proper medications.